So you can, like my colleagues can share on the behalf of me. They will also join the meeting and they will run because I am not able to run my video. So they will go on the behalf of me and I will speak, right? They will share the video
Sure.
slides.
Sure.
Okay.
So good afternoon, everyone. I'm Shuli Mehta from the Office of Principal Scientific Advisor to the Government of India. On behalf of the Office of PSA, our organizing partners, the Pune Knowledge Cluster, IIT Madras Alumni Association, and FICCI, I welcome you to the 12th session of the Innovation and Science at Bharat series. The series has, over the past 11 months, brought experts from industry and academia to share their experiences of building and nurturing relationships to work towards common goals. The series is meant to reach out to young researchers, entrepreneurs, and research managers working in the interface of academia and industry. To conclude this segment on application of drones, we have put together a panel of speakers who use drones to circumvent the challenges of seamless delivery of healthcare services in India. As the government of India rolled out a massive adult immunization campaign against COVID 19, speed and accessibility to the vaccines were one of the issues that posed a huge challenge to vaccine delivery. In addition, a large chunk of the cost incurred in immunization programs of low and middle income countries is towards supply chain logistics that also includes transporting vaccines from a central refrigeration facility to remote areas. Substitution of the traditional modes of transport with drones is expected to bring down these costs while ensuring rapid delivery in an emergency situation like the COVID 19 pandemic. In India, using drones has also ensured vaccines reach the otherwise difficult to access regions of the country. Our first speaker for today is Prem Kumar Pishlawat, who is founder and chief innovator Maruth Drones. Prem Kumar co-founded Maruth Drones with his batchmate Suraj Peddy and Sai Kumar Chintala. He graduated from IIT Guwahati with Electronics and Computer Engineering. Today, he will talk about Maruth, which is a drone technology solutions company based out of Hyderabad. His team created the technology to eradicate mosquito larvae and water hyacinth on lakes by using AI to predict mosquito population density and larvae count. The population density data generated is used for prediction of dengue, chikungunya, and other vector-borne illnesses. Listed under Forbes' the 30 Under 30 Asia list, Maruth Drones also won Facebook's India Innovation Accelerator Program 2019 in AI for Social Good and the Emerging Technology Award by NASSCOM for Drones and AI. Without any further ado, I'll now invite Prem to talk about Helicopter, a medical delivery drone. Maruth is working with the Research and Innovation Circle of Hyderabad, IIT Guwahati, and the Public Health Foundation of India for this project. Over to you, Prem, to talk more about Helicopter.
Thank you, PSA Office and FICCI, giving us this opportunity. So I just wanted to share my screen and take you through the work, what we've been doing it. 1 second. So you're able to see my screen, right?
Yes.
So we, as a drone company, started our journey way back in 2015. We first started working with the Public Health Foundation of India, and we did our first delivery with the drone in 2015. I'll take you through the journey what we did. From 2015 to 2021, we had a very more of a roller coaster kind of a journey, which we have gone through it. So basically, Helicopter focuses predominantly on the medical delivery. The two more of the concept of BVLOS we've been working from the 2015 onwards. So majorly the key aspect why did we come into this space is because we have seen the lack of infrastructure at a rural level, because in urban cities we have the multi-special hospitals and more of a diagnostic centers, but when it comes to more on the districts, mandals or villages, we see the transportation infrastructure or having the cold chain or the blood banks or takes a, like more of a the 2x or 3x of time, and in the when there is a pregnancy or when there is a snake bite, they immediately need in less than 30 minutes or 40 minutes long tail medicines, blood, and the more of the basic need of having diagnostic samples every day is still the challenge what we observe. And we saw that in India itself, it's a very terrain challenge because the south, north, or the northeast, they're different kind of the terrain challenge what we have. So that's where first we started understanding key. We did the more of the accessibility, or if I reduce the time. So we did a detailed study with the PHFI in one of the entire district of Nalgonda in Telangana. Then we observed in a larger scale with the drones, we could send the blood, vaccines, long-tail medicines for snake bites, and the diagnostic samples from a PHC or CHC to a district hospitals. So that's where the focus was to do this. And the important key aspect was the delivery was the temperature control and the more of vibration layers, or giving the blood or vaccines or diagnostic samples from a district hospital to PHC and PHC to a district hospital, two-way of communications kind of a thought process. That's where we started working from 2015 on the three aspects, where we were working with the more of the health departments or the more of the NGOs. And during the glaciers also in 2021 in Uttarakhand, we worked with NDRF. Then we understood these are a few things which are there. And still the medical delivery needs, there's a couple of the critical indicators which we have written here, the payload wise or the range or the communication, continuous communications, and maintaining the temperature. So we realized the importance having a temperature control, not in one box keeping all medicines and vaccines. That's why you'll see we built a heavy payload. At 16 kgs drone travel for 40-45 kilometers. So in that heavy payload, we keep a modular boxes. So in our drone, it can take 4 boxes. One can maintain it -3 degrees, one can maintain it like 8 degrees, one can maintain it like 80 degrees, like different, like in one blood vaccine, another temperature control box, another the diagnostic sample, so that like they maintain different temperature, can transport from a district hospital to a PHC. And soon we realized there is a tech integration also in every stage what we need. So overall, what we realized with the introduction of these drones were like they were doing easily 2 to 5 times faster than the transportation which is available by the ambulances or 4-wheelers or 2-wheelers. And it was around 1/3 of the road network while the drone was taking it. And the ultimate is the more the number of flights is, it becomes economical. So we are targeting by 2023, by next 1 year, having at least 1,000 flights in multiple cities and union territories, drones flying and everything. And soon what we realized is that the PHC or CHC level, they don't have computers, they don't maintain the ERPs. So one PHC needs a blood or vaccines, they're not aware. So that's where we started giving a small interface, the mobile interface to the PHC, CHC. They can schedule every day or they can request. So drone which is stationed at district hospital can travel from district hospital to PHC or CHC with a very ease of thing. So presently, we are using 3 models where heavy payload, long range, and the medium range drones we have at different payloads which we have. So both the Helicopter 1.0, Helicopter 2.0, both we have used in 3 cities at present in Telangana, Guwahati, and Gwalior cities. So the key aspect of unique is we are working with this PHFI. So with the lab, high rapid lab in PHFI, we came out this temperature control boxes which have the more of data log maintaining, and also maintain like the phase change material kind of a temperature control boxes, which are less payload kind of a thing, which are suitable for the drones. So this, to give you a glance, in 2015, first we did a delivery, then we started understanding it's not just a drone delivering from point A to point B. It needs a sizable payload to do it. That's where we started doing the weights of each and every medicines, diagnostics, and everything. We did all the mapping and everything. In 2018, we started mapping it like in a given district like Telangana or the state like Telangana. That like we need to do it hub and spoke model, do multiple clusters. That's where how much is of we said like 30 to 50 kilometers is ideal way to transport from one hub to other hub. So this was the publication which is released in 2018. That's where we started talking it modular temperature control boxes, heavy payload, and long range. So, and we're giving our entire this as a 2018 starting working on like, can I send a whatever a PHC needs, like around 10 to 15 kgs every day to a PHC or CHC. That's where first we started in 2020 when Civil Aviation Minister Harpreet Singh Puri sir was coming to Hyderabad in Wings event. We demonstrated a medical delivery there with all the permissions and exemptions, and that's where the Telangana government has started this project with a World Economic Forum called Medicines from Sky. In 2021, we did our first BVLS the delivery in by September 11th in presence of the civil aviation ministers and other dignitaries. So the key aspect why you've seen these deliveries, right? Where we got this motivation is because if you see district hospitals have a district multi-specialist hospital which has blood bank, ambulances, all have our diagnostic centers and everything. So this all give you a glance of which are in districts, because a lot of ministers or bureaucrats are in district level. When it comes to PHC level, it looks like this. So PHC doesn't have 100% infrastructure. That's the reason every time they don't have a cold chain maintenance, they cannot store any blood or diagnostic sample, even blood tests they cannot do properly. So that's where we started thinking that transportation has to be from a district hospital to PHC and PHC or CHC to district hospital, two-way kind of communications. And the first challenge was this, the accessibility point of view and transportation point of view. Second was in still today at remotest village, they write on books and papers and they don't digitalize it. So because if it's one village having a like HIV patients or having diabetes patients, they've been sending it specific medicines month on month. They don't know how much they to pile up. So if Southern PHC has some pile up of medicines and everything, they're not aware. That's where we started working on the mobile app, which I've showed in tech. So district hospital has a web interface and PHC, CHC has a mobile interface where they can request, schedule it and everything. This was a detailed research doing with all the PHC, CHCs in Telangana. That's where we started thinking of it. In Medicines from Sky, this is one of the glance to tell you is like we did around 42 kilometers of a delivery in 40 minutes. By road, it was taking around 2 hours, 40 minutes. And since we are saying it in multiple temperature control boxes, so we have carried a box one at different temperature, box two at different temperature. So overall at 16 kgs payload at different temperatures, we could able to deliver it. So that's why we say it's heavy payload and long range. And during glaciers, we did worked with NDRF, sending from one mountain to other mountain the medicines, first aid kit, and food, whatever the NDRF was suggesting. For 2 months, we worked with the NDRF in Uttarakhand there. And in Guwahati and in Gwalior, in presence of the Major VK Singh ji and the more of Jyotiraj Singh ji and Shivarajan Singh ji, we did in Gwalior. And not only this, we started doing the outreach and more of awareness activities entered Northeast, all the states of Northeast, taking with the help of PHFI and the other partners in Northeast. We have his IT Guwahati as a partner. And few of these, our model is, if you see the right, if you have to have a medicines in every nook and corner, you need to have a blood bank, or you need to have a the medicines or pharmacy and everything. But as a system, it's very difficult to keep everywhere. That's why we see in the 14B, where in selective places you see a blood bank, selective places with pharmacy. Our thing is to go with more of the hub and spoke model, where smaller nodes we connect, and from the node to node we connect it. So that's why we think of this distribution of what we're doing it in the 14A here will actually works in a rural areas and in districts, what we are planning doing now at present. So overall, what we did is we did a lot of mind maps and we did a lot of more of data analytics on where to be creating a hub per state and from where the distribution network should create and how much area. So we taken like 30 to 50 kilometers as one hub model where we are connecting all the PHCs and CHCs to that hub, which has a district hospital as a center point of it. And in the Northeast and few of the areas which feel that like terrain is a challenge, you cannot land. That's why we started working on a model of giving more of stations where drones automatically lands and automatically picks up kind of the mobile kind of stations, which 2023 we're trying to do it in the more of a few of the areas of Uttarakhand or the northeastern areas. The overall, our thing was every day we send 2.5 to 5 kgs worth of whatever needs from PHC, CHC, and weekly or like twice a week we want to send sizable things which can PHC or CHC needs kind of a thing. So basically, anyway, we're trying to take care like 5 to 50 kilometers of transportations and everything. Majorly, we did a lot of the data analytics so that we arrived to this model will be ideal for India and ideal, which is workable kind of a thing. And when we started understanding then how many CHCs or PHCs are there in India and everything, that like companies like us, there's like hundreds of companies that needed to cater this kind of a thing. So the overall thing is to build this ecosystem. Basically, we are trying to bring as many people like us in the ecosystem and do this real-time, everyday kind of a logistics in, like we are targeting all the 28 states and 4 union territories in 2023 and 2024 to make it functional. So as you know, everybody has this well addressed the challenge and everything. So this was to give you, and we have worked with very close partners with World Economic Forum, Public Health Foundation of India. In the Northeast, we worked with IIT Guwahati, and all clinical trials have been done by the Apollo hospitals in Telangana. We have a team, so all the leadership team is alums of IIT Guwahati, which we have there. And in course of time, we've been recognized nationally and more internationally with a couple of the organizations. And the whole thing is our work has been taking places, so that's we wanted to take this as a medium to share like what we've been doing it in from last 2015 to till today.
Thank you, Prem. Thank you very much. At this point of time, I would like to inform our attendees that they can visit this events page to download presentations of all the previous sessions and in a day or two of this month. Next on, we have Dr. Sumit Agarwal, who is working as a scientist in the Division of Epidemiology and Communicable Diseases of ICMR. Trained in community medicine, Dr. Agarwal is Member Secretary of Operational Research Group under ICMR's COVID-19 National Task Force. He also serves as an expert on various national technical and review committees. He's an investigator for a range of projects, vaccine delivery through drones, development of iNovacop portal, STI networking at national levels, AI-based diagnosis of COVID-19, and social behavioral impact of COVID-19 being a few. Today, he is here with his team members to talk about ICMR's iDrone project, which is delivering vaccines in the northeastern region of the country. Dr. Agarwal is joined by Dr. Prakamya Gupta, Scientist C, ICMR, and Devesh Shah, founder and MD Daybest. Dr. Gupta is currently a scientist at the Medical Devices and Diagnostics Mission Secretariat of ICMR and works on clinical validation of novel medical devices and diagnostic products. Devesh Shah is an entrepreneur who builds drones and UAVs for use in aviation and robotics with applications in agriculture, defense, space exploration, developing smart villages, education, and healthcare. During the session, Devesh will talk about the innovative solutions that Daybest provided for ICMR's iDrone project so that vaccines could be delivered in what are very difficult to access areas of the country. So over to you, Dr. Agarwal.
Thank you, Sivli. Can you maximize it? Yes, so today I'm talking about the ICMR's drone response and outreach in Northeast. Actually, this is a very innovative concept. This is a very innovative concept or proposal we tested in IIT Kanpur. So this was started in December when ICMR was working on the vaccine, and our DG Sir Professor Balram Bhargav was thinking of delivery of vaccine through the drones. So we started this activity, and we started with the most difficult part of the India, that is Northeast. And so we selected Nagaland and the Manipur and also the Andaman and Nicobar. So next slide, please maximize it. So, here you just know, like, there are the numerous challenges, you have already said. There are numerous challenges in delivery of vaccines, and India is being a second most populated country in the world, and also it has a very difficult terrain type: mountains, desert, forest, island, and hill, and so many other things. So it is never a easy task to deliver vaccine in these areas. But here is a hope, UAV, that is known as a drone as well, and these are now being used in the delivery of medical supplies, but it was never tested before for the delivery of vaccine. So ICMR thought of innovative projects and conceptualize conduct a feasibility study and not just a one or two sorties, not for the business model, but also the public health importance. By that, we can deliver vaccine and medical supplies to the far-flung areas. And India is the largest vaccination program in the world. So if we can do that, that will support the government in the public health delivery. So we conducted this study. So highlight this importance of this study. We'll see a small video. Yes, please. Can you see the video?
We are just starting to see the screen. We can see the video. But there's no sound.
So here, PM Modi and our cabinet minister is highlighting the importance of this, and they also recognize this as one of the important source of delivery of vaccine, as India has achieved now target of 130 crores delivery of vaccine, and these drones has now contributing in the northeast. And we till now we have delivered around 17,000 medical supplies delivery in the northeast. So this is just to highlight the importance of this. So this which what we conducted was a feasibility study that was conducted in two phases. In the phase one, it was conceptualized and taken approval by the technical committees and the all ethics committees. And then we did collaboration with the IIT Kanpur and CD Space. And we did this study just to see whether these drones can maintain the temperature where there should be no harm to the integrity of vaccine, there should be no harm to the vials. So we conducted this phase one trial. In the phase two trial, we conducted this study and we took all the necessary approvals, and we took also the ethics approval, technical committee approval, all the government regulatories approvals, and then we did a coordination with the state, multiple states simultaneously, and then we identified the sites. So this was the phase one and phase two study that we conducted. So now we'll see a brief phase one. So in phase one, this was conducted in IIT. Here you can see the pictures of these dummy vaccines, dummy vaccine vials, which we conducted in the airstrip of the IIT Kanpur. And this study was collaborated with the Bharat Biotech. And here, actually, we were using a hexacopter drone, which were able to that was able to carry around 4 to 5 kg of payload. And that here we flew around 20 kilometers, and here we use the dummy vaccine vial because due to ethics reason we were not able to use the original vial. But here what we learned, that temperature was maintained if you are using a proper vaccine carrier box. So temperature was maintained in all extreme temperature, various humidity and all, and these all were integrity was okay, and there was no damage to vaccine vial. So this was first study that this was a we lost trial which we conducted, and after this we did a presentation to all the regulatories, Ministry of Health and the Ministry of Civil Aviation. On the behalf of this, we got approval for the phase two, that was BV loss trial. Slide, please. So here we conducted various meetings with the Indian officials, Indian Immunization Department official, and they suggested northeastern state they are facing most difficulties. So we chosen the Nagaland and the Manipur in northern state, and the one union territory, that Andaman and Nicobar. So after taking all the initial, again the technical approval, ethics committee's approval, then all the officials approval, we started searching for the drone, because ICMR is basically a health research agency. So we were not able to make our drone. So we tried to identify the drone company. To keep it transparent, we floated the expression of interest, and by that we were able to select four or five companies, and out of them, Daywest was chosen for the final delivery of the vaccine. So here, just to check whether it is feasible or not, because it is not just a business model, but here we want to see whether if we want to take up this vaccine delivery in the world largest immunization program, whether we can adopt it or not. So for to see that thing, we need to check the feasibility. Or here we checked for the 5 component of feasibility, that is acceptability, adaptation, practicality, integration, and implementation. And all these 5 feasibility points were very important if we want to adopt this method as a public health delivery method. So next slide, please. So for first component of feasibility study, adaptation. Adaptation is very important in the terms of that, like for here, like Maru drones are here, CD space is here, Ro and Daywest is here. So they are not going to be here for all the time, and we cannot. We are the Apex Institute. We cannot be there for all the time. So we see how we can adopt the healthcare worker. We can how we can help them to adopt adopting this facility, this drone facility. So we try to identify the training module. We also developed a training module SOPs. Like if we are not there, if just 1 or 2 pilot is there, so how they will adopt it. So we did a training session. We conducted a pre and post training testing, and overall in 2 states we trained 76 healthcare workers, and these all healthcare workers were able to receive the vaccine supplies from the drone, and they were able to send it back drone to their original destination. So actually, so we did this training part to see this adaptation, and we also assessed this part. So next slide. So then the second thing, if your healthcare worker are if trainable, if you can do, then it is very important acceptability of the state, acceptability of the stakeholder, whether they can accept it or not, because acceptability comes from the higher authorities. And if they are not accepting this new technology, like then we cannot incorporate this into the system. So here we conducted a qualitative research, and we were having our anthropologist with us all the time for 3 months in the Northeast, and we interviewed around 35 officials, that includes the IAS, bureaucrats, technocrats, doctor, healthcare workers, and the laymen also. Those who are going to use, those who are actually going to implement, those who are going to incorporate these things into the policy. So it is very important to understand whether they want to do it or not. So their acceptability we also assessed through the qualitative research, and it was very surprisingly, they were very happy, and they were even keen to adopt it now. So acceptability is very high. We found this is very high in this our study, and especially in the difficult region like Nagaland, the state government is keen to adopt this technology right now. So next slide. Because then the third thing come, like you have trained healthcare worker, you have a system which is accepting this technology, but what is whether that there is practicality or not, because practicality is important. You have all things, but this is not practical. So we have assessed various very large questionnaire, very thorough parameters we developed, and we try to assess the time taken, weather condition, medical goods availability, integrity of goods, manpower combination, how we will do it. And there was a variety of landscape where we tested into the land, island, foothills, valley, hill, and their combinations, their reverse combination, land to island, island to land, foothill, then valley. So all types of combination, we conducted around 80 sorties, which were covering around 1,000 kilometers. So these practicality we accept, and we also tried various kinds of drone, which was hexacopter, quadcopter, heli kind of drone, single rotator, VLOS, electric VLOS, so VTOL. So these kinds of drone we used to see the practicality. Next slide. So here, like in when we were working in Nagaland, so there was one place there was no single platform. So we also tried delivering of vaccine by using a rooftop. Here, the drone was take off from the rooftop, landed on the rooftop of the PSC. So this is just one example. We have numerous such examples where we saw the practical difficulties, and we were able to cope up. So ultimately, it shows that the practicality of this technology in adopting healthcare is very much possible. Next slide. So these are the implementation challenges. We also, like now we have a technology which can you can use. You have healthcare worker, trained healthcare worker, and you have this thing commitment. So here we use the implementation, how we can use, how we can implement. So here you can see we have tested so many models: land to island, land to land, land to foothills, land foothills to hill, then valley to valley, hill to hill, and hill to valley. So there are more than 30 centers, PHCs, district hospital, and we tried this thing, this our iDrone project for 3 months. They are in every robust and worst condition. So we were actually successfully, we completed all our trials in Manipur and Nagaland. Next slide, please. So last, when you have everything, so one more important thing, how now you will integrate this new technology in your existing system, because you cannot put burden on the public health, because that we are already a middle income country, and we cannot ask government to give us so many healthcare workers. Those we will add, those will be needed for the delivery of vaccine. So we saw the possibilities how we can integrate this system into the existing system. So we did the training. Here we assess the existing health system. We identify how they are logistic chains are working, and how we can integrate this iDrone technology into their existing public health system. So we were able to do that. And also, like Maru Drone has developed some application, we have also developed a indigenous application. Next slide, please. So that this is a iDrone portal which was developed by ICMR, and here what we were using this iDrone integration system that can be operated from the mobile tab or any digital platform. And here you can generate the request to indent the medicine. And this what was the specialty of that? We have not used our format; we have used the state's format. So by that they were delivering medicines. So we used the same format. So there was no difficulties were observed during the delivery of medicines, because they were very much familiar with this indent format, and they were able to use it successfully. So now here, next slide, please. So now we did not test it only just for the vaccine. We were able to transfer the variety of medicines, syringes, gloves, PPE kit, glass bottles, iron folic acid tablets, contraceptives, so many things. Like what is possible in the healthcare delivery, we did all the things. And we just not delivered just 1,000 or 2,000, we deliver around 20,000 medical supplies. So to see the various acceptability, practicality, integration on all everything. So next slide, please. So this is just a glimpse of iDrone activities. We cannot cover definitely in 8 to 10 minutes. So we conducted total 80 sorties, and first time for the in South Asia we conducted medical supplies from the land to island, and it was carrying a Covishield vaccine. And then we had a longest distance drone flight from Twinsang to Mokokchung to Twinsang, then return Twinsang to Mokokchung. It was around 40 kilometer, carrying 3,500 medical units, and the land distance is around 100 kilometer, and which takes around 8 to 10 hours. So we were able to complete this sortie in just 28 minutes. And this after this successful mission, the state was very happy, and CM also tweeted about it. So apart from this, we connected around 20 centers in Manipur, and around 12 to 13 centers in Nagaland. We delivered 17 more than 17,000 medical units. We did the training of 70 healthcare workers. We conducted in-depth interviews for the officials of healthcare workers, and it was widely covered by the media in worldwide. UNDP also and WHO also appreciated this event. And also we have developed SOPs and training modules which are in under the stage of validation. So by that state can directly adopt this. So ultimately we flew for the 735 kilometers, and that was equal to 2,000 kilometer. And we saved a lot time. It was on average it was taking 1/5 time of the services which were delivered by the road. So next slide, please. So here are the few glimpses of these things, how we conducted this Mokokchung to Twinsang. Next slide, please. So here we also faced some challenges regarding the getting of topographical and data, and transportation and travel, takeoff and landing site near to healthcare centers. Language barrier was important, local establishment and community participation. These difficulties we were facing, but we were able to cope up. At the same time, we were able to help healthcare workers, because they were having apprehensions about the drone things. So our training part did work. They were doing their duties in remote and isolated part, and they were feeling very helpful when we delivered these drone based deliveries to their hospitals. And there is unavailability of facilities in the terms of roads, vehicles. So these are the difficulties. And there is always insufficient manpower. If one person will go, their PSC will shut down. So these deliveries were actually helping them out, and then there is a high time consumption by the road. So all these were the difficulties which usually faced by the healthcare worker in these areas, and we were able to solve these all difficulties in Northeast state. So before these are the operational and implementation part, but apart from this, we also took a detailed discussion with the regulatory authorities, and for that, our my colleague Dr. Prakamya Gupta will speak on this, how we got approvals and what were the difficulties faced with regulation. Over to you, Dr. Prakamya. Thank
Thank you,
you.
Dr. Suman. I'll quickly share my presentation. Is my screen visible?
Yes, it is, Rakamya.
Yeah, so thank you, Dr. Sumit. I'll briefly talk about the regulatory approvals and the coordination we did during this iDrone project. So the Ministry of Civil Aviation came up with the drone rules in March, and it was really restrictive in nature. A lot of paperwork needs to be done and extensive permissions were required. And recently in August 2021, they came up with a new drone rule, which were replaced by the old rules, and they were all balancing the safety and the security, and was moreover of a single window platform for taking all the permissions. So in India, we need basically permissions from Ministry of Civil Aviation, Directorate General of Civil Aviation, Airport Authority of India. And apart from that, we also took additional permissions are required from Ministry of Home Affairs, from Deputy Commissioner, Superintendent of Police, Intelligence Bureau, Regional ATC, Air Traffic Control, military and paramilitary regiments, and Indian Air Force. So ICMR was granted approval from MOCA, DGCA, Airport Authority of India. And apart from that, they gave us a conditional exemption where first we need to do a VLOS experiment before conducting the BVLOS. So we, as Dr. Sumit just mentioned, that we did our VLOS phase 1 at IIT Kanpur. And even in BV loss exemption, which was given to ICMR, they mentioned that we can go only up to 3,000 meter MSL. And apart from that, the Authority of India gave us the permission only to fly up at 120 meters above ground level. And these sorties need to be conducted only during the watch hours. And we need to have a prior clearance from the regional ATC. So ICMR had already obtained approval from the state health authority, the district administration, the deputy commissioner, and the superintendent police. And subsequently, the Airport Authority of India granted NOTAM, that is the notice to airmen, for doing any flying activities. So coming on to the operationalization, ICM, like a day, how we went ahead and did this. So one day prior to taking any flight, we were supposed to give a prior approval from the ICMR authorities, district health authorities such as CMO, Chief Medical Officer, Deputy CMO, District Immunization Officer. And apart from that, we also informed police, IB, military and paramilitary regiments based in that particular area. And we need to take clearance from the regional ATC or the private private choppers flying in that particular area. Dr. Sumit just mentioned about our longest flight that happened in Mokokchung to Twinsang. And in that, we took approvals from the district health authority of both the districts. Apart from that, we also had coordination, a close coordination with police, IB. Then the Jorhat ATC, we were supposed to take clearance from 3 different ATC, that is Jorhat, Dimapur, and Guwahati. And the Jorhat ATC is directly under control of Indian Air Force. So we took approvals from Indian Air Force also. And the regional army regiment, which was Assam Rifles. So we used to take clearance from Assam Rifles before taking off any flight. So coming on to the major challenges, like Dr. Sumit just mentioned, and I'll just give a small extension to it. Like the BVLOS permissions were given only after the VLOS experiments results we showed it to the Ministry of Civil Aviation. Apart from that, what type of drone we can use? We were using different type of drones: quad, hexa, heli, VTOL, hybrid VTOL, for different terrains, for different locations. As Mr. Prem and Dr. Sumit has also mentioned, like transferring different vaccines, tablets, syrup bottles, they require a different set of mechanism altogether. Like vaccines will need to be sent in a temperature control. So like the PPE and the gloves are very weight wise they are less, but they are really bulky. And the syrup bottles, definitely they are really fragile. So we need to consider all these aspects. Apart from this, we observed that there is loss of telemetry at some point of time. So we were not just using a RF module, we were also using a cellular and a GPS based module, so that we really need to know the health and the location of our drones. Before taking off any flight, we were supposed to send the KML or the route map to the Airport Authority of India and the ATC and get clearance for any other aviation activities going on in that particular region. Apart from this, we used to take clearance from the regional ATC, the Jorhat, Dimapur, Guwahati, Assam Rifles, definitely, before taking off any flight. So one thing we observed that whenever there is takeoff or landing, there used to be a heavy gathering. So we coordinated with the local group leaders and the community people to help us out, explain them in the local language, so that there should not be any mishap to any human life. So I would like to thank our the DGCA, Ministry of Civil Aviation, Ministry of Health and Family Welfare, the Airport Authority of India, Government of Nagaland, Government of Manipur, Bharat Biotech, CD Space, Daybest, Red Wings, Tech Eagle for helping us out with everything. And moreover, there's the vision of Professor Balram Bhargav and Dr. Samiran Panda and my team, Dr. Sumit Agarwal, Dr. Balaji, Dr. Nupur, Dr. Jitin, and Dr. Saurabh for helping us out. Now I will request Mr. Devesh to explain about the drone, the technicalities about it. So thank you from me.
Thank you very much, Dr. Prakamil. So as we are very privileged to be part of this revolutionary project. We coined a term called the drone which bring hope from the sky. So we faced many challenges there, right from operations of aircraft and the selection of the aircraft. Like this aircraft, this was a hilly terrain, and in the hilly terrain, weather is unpredictable. So we started delivery with this autonomous helicopters, where this autonomous heli was very stable while doing the flying activities. We started with the minimum payload, and then we keep increasing the endurance and the payloads. So as we are very much thankful with the wonderful team from the ICMR and then our partners like Helicam India and the Viorius who were providing us telemetries and other necessary equipments. So like when we started first delivery, we used our aircraft Sudarshan, which had a payload capacity of the 4 kg and it has endurance for 15 minutes and 30 kilometers it can go. So the challenges started right from the selection of aircraft, then the transportation of the aircraft, because this region was very remote from our locations where we are building the aircraft, Bangalore. So we had to make a lot of plan. We have to burn a lot of money and other resources while carrying these aircraft from the Bangalore to the desired location, like in Bisnupur and in the Manipur and again then in the Nagaland. And the necessary approvals, like we cannot carry the battery, and also there are a lot of problem we faced, and the team ICMR, Sumit sir and Prakamish sir and all of the team member were helping us out day and night, so we could keep the missions going on. So like like our aircraft is built for multiple applications, mostly right starting from the vaccine delivery. Then in the future it will be able to do the organ delivery and the other applications as well. So if you will ask about what is the actual capacity of this aircraft, like we have built this propulsion power plant, which is the now we are integrating it with turbine engines. So stability of aircraft in the wind resistance was very much needed, and then the area where we are landing were very constant. Like earlier, the speakers has explained you, and as the Marut Rose also explained, that it's very difficult to connect with the PSCs there, where actually the access problem is there, and so these kind of aircraft is able to land in just in 3 meter to 3 meter capacity areas only. Then we use these we did some delivery with hexacopters with help of red wing labs. We started because the high capacity of these kind of hexacopter is very much, it can carry heavy payload, but the endurance is very less. So we use these type of aircraft doing the the shorter distance, and with the maximum payloads. This has also the all the feature, like we are talking about, it's completely autonomous, because uh, while you are flying in that hilly region, you need the obstacle avoidance sensors and the laser finder and the real, and that because telemetry has a lot of issue because you don't know the actual terrain. So we needed to always maintain 300 meter 150 meter to 300 meter AGLs. Many times we have to change the flight plans as per the, because we were not knowing the exactly what is the height of that particular hills. So many times we were trying to do the change the flight plan as per the aircraft suited with these environments. Then we invited some of the our other colleagues also, and other partners. They helped us to deliver the vaccine in the remotest part, because even the autonomous helicopters had some limitations, because a battery powered heli cannot go more than 40 kilometers, but there were some of the sites were far from the 40 kilometers. And then we selected these VTOLs. VTOL has some limitations while because it can fly in the days only, but it can carry up to the 8 kg and it can go 100 kilometers. So we use both type of VTOL, which one is battery powered, another is the hybrid eVTOL also. eVTOL also has some kind of it can land in the very constant places. And then these aircraft are also very fully autonomous. So total, while we were doing these activities, my personal experience was we needed to work out more about the payloads and the kind of medicines we are delivering there. So we must have a complete end-to-end supply chain system. So we should, as an operator, we should be informed earlier that which kind of payload we are carrying, or we should be integrating in our module only. So suppose someone has requested the blood samples and also we could deliver it in the real time. And the night operations in future will be also needed. So we are working on that part. Like team will be also working on the regulations, so the aircraft could land even when there is no visual range, or when there is a little the kind of weather is not good. So the industry, and as we are, because after learning from this project, we got to know that we must make our aircraft robust while we are delivering these medicines in the northeast area or in the hilly area. And the real-time telemetry and weather should be very prior, and as well as the payload systems. So these kind of challenges and the opportunities are endless, like right from, because earlier we thought that we will be able to deliver, we will be delivering just COVID vaccine, but from the state and the ICMR we got a lot of inquiries to deliver the medicines like iron, folic acid and all. So like right from the Visnupur to PSC, we did samples. These are the calculations where we calculated, because we did in Karang, then in Thanga, then in Moirang, and then the Kumbi. These are the locations, and in the from the Mokokchung also we delivered. And very soon we will be going in the other states like Andaman, where we will be doing this delivery on the land side. Thank you. Over to you.
Thank you very much to the team from ICMR, Dr. Agarwal, Dr. Gupta, Devesh, Prem, of course. So Prem has a video from Marut Drones that he wants to play. So Prem, if it's okay with you, I would like to take a few questions and then we can end with your video, right?
Sure, please go.
Thank you so much. So I would, our speakers could cover a lot of ground, touching upon a range of subjects which we had not taken up in the last few sessions. They also were not relevant to them. So regulatory, administrative, and then technology acceptance being a very important area that one of you touched. So the first question that I have got from one of our attendees watching the session live on YouTube, and I'll rephrase it a bit. So what were the challenges faced at the user level? In this case, the healthcare workers. So any of you can take the question because...
Yes, definitely. It is important question. Actually, it is a component of the feasibility when we see adaptation at the ground level worker. So it is important because user, like if you are delivering a medicine or any supplies, any medical supplies, so it will deliver to a patient ultimately, but the user, like vaccine who is giving as a healthcare worker. So it is very important to understand all the apprehensions related to drone. They should be aware about the basic knowledge of the drone receiving, delivering medicine and sending it back. So you cannot do it by just telling them. So there is a need of training. So that is why we have already developed SOPs and the training module for the healthcare worker. And these SOPs and these SOPs and training module were very much helpful in to give a training them. And after these training, they were able to receive all the medical supplies, and they were able to use this medical supplies by the drone. So it is important. Yes, over to you.
Thank you. So Dr. Agarwal, is the other results of your feasibility study available somewhere, or are you going to communicate it?
Yes, actually we have collected around 35 in-depth interviews, and we are also doing the content analysis and the qualitative analysis by in vivo. So soon we will become out with our key findings of the study.
Sure. Thank you very much. Prem, is there something that you want to add to that list?
Yes. So basically, we are doing from a fixed point to point, right? From district hospital to PHC or CHC. What we did is we started identifying the ASHA workers and healthcare workers before the delivery itself. We took them entire the process and explained them what need to be done when they go to near to a drone, like disarm happens and what to do. And once it is there, how do they update it? So drone automatically starts and everything. So majorly at present, the fixed positions we're doing it. That's why we have fixed SOPs and fixed kind of the training we're doing it. Because I think for next 1-2 years also, the entire delivery going to be from a fixed positions like PHCs or CHCs to our district hospitals, kind of a mapping what we see. That's the reason it's like how the ASHA workers get trained to handle the medicines or doing it. We would do that basic thing, and it was very easy for them to adopt because generally they do the basic digitalization on blood samples and at a rural level. So we saw their adoption is faster.
Right. So, Dr. Prakamya, the next question is for you. There was one slide that was titled Exemption for ICMR. So was it exemption for ICMR or specific products, as in for vaccines, medicines?
It was specifically for ICMR for delivering vaccines, medical supplies, everything. Medical supplies basically. So we got we got approval from Ministry of Civil Aviation, DGCA, Airport Authority. Like it was a chain of approvals we had to get.
So if a different organization is delivering vaccines, they would have a different they would have to go through, of course, a different set of approvals, right?
Depends. Like
I can add here a little bit. Now, as per the new drone policy, you don't require much of clarification, like approval specifically from the DGCA and MOCA to fly up to AGL 120 meter or 400 feet. But actually, it is not that mean you don't need to coordinate with the ATC, local army and police. You always need to coordinate with the ATC, local police, and the administration and the state authorities, because there might be an army area, there might be a restricted zone, or there might be a flight or something. So that may be a random chopper activity. So for that, you don't need as per DGCA or MOCA approval, but it would be worthwhile to get approval from the local authorities and the state authorities and ATC and local army as well.
Sure.
Yes.
Like
Prem, is
some
there
of the
something that you wanted to add, or you wanted to talk about the drone
So
policy?
basically, we have gone through full cycle from 2015 to today. Today, what we see, it's a luxury where people can think of doing a delivery. So basically, what recently also we have seen, so one of our clients requested for BVLS. So for one of the things that particularly say, if it is a green zone, you don't need to take any of the special permissions like the VLS or BVLOS or thing. If it is a green zone, communicating with the ATC and the cross-checking the airspace with the airport authority, immediately we can start the delivery within no time. If it is a green zone or the red zone, that's where again it has to be gone to the Ministry of Civil Aviation, the thing. So when we started in 2015 and when we did 2018, we took there are a lot of different kind of agencies with needed different kind of thing. And I think thanks to the present minister, civil, the Jyotiraditya Scindia sir, and the more of Joint Secretary Amrut Dubey sir, and a couple of other like from DGCA, they've simplified a lot. Like the more of the one, thanks to COVID also, which has amplified and accelerated the entire drone space, which never we could have thought this fast would going to happen. So basically today, if a client really wants to deliver, really wants a drone delivery, I think it's a matter of a day or two to kickstart his operations and start doing the deliveries.
Right. Thank you. Thank you very much, Prem. So that would be all from the questions. Do you want to share that video now?
Yes. So this video I wanted to show particularly is because we took a lot of blood, sweat to convince the regulatory bodies like MOCA, DGCA, and everything. September 11th, when the first official BVLS delivery happened, when the minister himself came to the More of Vikarabad, and he actually saw whether the delivery happened at BVLOS and everything. That's the small video which I wanted to show to everyone. You're able to see my screen. You're able to see my screen?
A lot of people die simply because medicines did not reach them in time. So is medical logistics a real issue? Yes, of course. This will unleash the potential of the youth of our country. The intersection of technology and healthcare is an exciting opportunity. If you can actually send a drone to any of these PHCs, you could possibly cover these 50 kilometers or 100 kilometers from a district headquarters in half an hour or less than an hour. And you could actually send temperature controlled products like vaccines, medicines. You can also bring back blood, and these would actually be a reliable supply chain. हमारे आंखों के सामने एक नई क्रांति देखी है ड्रोन टेक्नोलॉजी। पहली बार विश्व के इतिहास में जब पहली बार विश्व में क्रांति आ रही है, भारत एक फॉलोअर के रूप में नहीं, लेकिन भारत एक लीडर के रूप में ड्रोन टेक्नोलॉजी में आगे बढ़ रहा है। हमने तेलंगाना में देखा।
Thank you, Prem. Thank you very much. So, medicines from the sky and hope from the sky. We are ending this series of session for this year on a very positive note. Thanks to all our speakers who presented two very amazing stories today. Over the last year, the Office of PSA brought together many such industry partners, startups, and academic institutions to develop innovative solutions to support different R&D sectors through the Innovation and Science at Bharat initiative. Through this series, we hope to build and nurture more such partnerships. Since this is the last session of this calendar year, I would like to take this as an opportunity to thank all our speakers for being a part of this series. We are also very thankful to the organizations for participating. I'm extremely grateful to the teams from FICCI, Pune Knowledge Cluster, IIT Madras Alumni Association for helping us to put together this series. If you missed this session or any of our earlier ones, they are all available on our YouTube channel, Science, Technology and Innovation in India. And these videos are also available on our website. Do join us for the next leg of Innovation and Science at Bharat series in January 2022. Thank you, everyone.
Thank you, PSA office and Shivli for organizing this wonderful event. Thank you. Thank you all, my team members as well. And congratulations to Bharat Drones also.
Thank you, PSA Office, FICCI, and the entire ICMR team. I think it's a great learning knowing about the work, what is happening at present.
Thank you, everyone.
Thank you, everyone. Bye-bye. Good day.
Bye, good day.